Mental health check. It's OCD Awareness Week here in the United States, a time to break the stigma around obsessive compulsive disorder and dispel common misconceptions.
About 8 million people in the U.S. will develop OCD in their lifetime. It's a condition that can be extremely disruptive to everyday life. You might recognize our next guest. She is Katie Horwitch. She's a mindset coach and an author. She's with us a lot for other segments. She's also was diagnosed with OCD 3 years ago. And Katie is joined by Lata McGinn. She's a clinical psychologist and vice president of the Access Psychology Foundation, which I should mention I serve as a board member on. So great to have both of you. Katie, this is kind of your first time speaking out publicly about your diagnosis, right? When did you realize that you might need to see a doctor and this might be an issue? And I kind of wonder why you're speaking out.
Yeah, well, it's OCD Awareness Week, as you said, so what better time to raise awareness about this? And a lot of raising awareness is about dispelling myths around OCD and how OCD shows up in the first place. I actually got a diagnosis because I went into a psychiatrist thinking I had something completely different going on. I was experiencing extreme fatigue that I could not explain. And after I did this very long evaluation, he diagnosed me with generalized anxiety and OCD. Now, the fatigue is the thing that I was focusing on, but what was actually happening is my brain was working really, really hard every single day. I was experiencing hypervigilance, an inflated sense of responsibility, like everything was my responsibility, my weight to carry. And that led to me missing deadlines, strained communication, a feeling of persisting guilt that really stood in the way of me reaching goals and living the life that I wanted to live.
Well, I'm so glad that you got that clarity from your doctor. And Lata, I want to bring you in because we've seen people with obsessive compulsive disorder on TV. Maybe we know someone, but walk us through what exactly it is, OCD, and give us some examples of common obsessions and compulsions people might face.
Yeah, so OCD, basically, I guess the easiest way to describe it would be people have recurrent intrusive thoughts. And that something bad is going to happen to them. And then, as Kate said, that it's a way of, maybe that I'm responsible for bad things happening to other people. And so they feel compelled to stop thinking those thoughts and then doing things that they believe are dangerous. And then they engage in a lot of unnecessary, time-consuming sort of rituals to try to stop that bad thing from happening, as an example. I guess common ones would be, fear of contamination, fear that, something bad, like my mom might die or I might kill my baby by accident. So taboo thoughts are common. Sometimes people are very concerned about asymmetry, so they try very hard to make sure that things are very symmetrical. I would say at its essence, OCD is a doubting disease. So it's where people are very afraid that something will happen.
And Lata, how is OCD commonly treated? Because it is treatable, right?
Yes, it's very treatable. I would say the most recommended treatment for it is CBT. And within that, exposure and response prevention is the single most effective form of CBT for OCD.
CBT, you have to define for people, cognitive behavioral therapy, right?
All right. Yes, Kate, thank you. It's cognitive behavioral therapy, and exposure and response prevention is the active ingredient that is the most effective form of it. It involves gradually exposing the person to their obsessive thoughts, triggers, and preventing them from engaging in compulsive behaviors.
Yeah, Katie, I want to go back to you because a lot of people just don't understand OCD, lots of misconceptions. What do you want people to take away?
I want people to recognize that, first of all, OCD is not just about liking things really clean or in a specific order. OCD is a debilitating mental illness. It's not an adjective like, oh, I'm so OCD because I love to clean. It is a clinical diagnosis. And I describe it as extreme catastrophization. So the if-when equation seems very outsized to other people. But for the people who are experiencing OCD, it's incredibly real. So it's really important to be able to recognize that and find out more about OCD so that you can be the best support system possible.
Yeah, and you mentioned misconceptions. Are there things that you wish people knew that that they would know not to do, or how to, if they're your friend, how to support somebody with OCD?
Yeah, well, a big one that people don't really talk about unless you're in the OCD community is just like Lata said, OCD is not just about the obsessions, it's about the compulsions. A common compulsion can be asking for reassurance. And so sometimes people who really want to help their loved ones with OCD can actually perpetuate the OCD by participating in those compulsions.
Unintentionally.
Exactly.
Yeah.
And so it's really about validating the emotional experience and empowering the person who has OCD to move forward in their treatment.
Really powerful to hear your story. Katie Horwitch, thank you so much. Lata McGinn, thanks for being with us.
There's much more news ahead.
You're watching NBC News Daily.